Thank you all for taking time out of your day today to join us for this webinar workshop this Wednesday morning, excuse me. We appreciate you waking up and spending just a small part of your day with us. My name is Brian Griffin, a marketing assistant here at Messer Financial Group. Many of you are already familiar with Messer Financial, but in case you don't know, we are an FMO located in Mint Hill, North Carolina. We started with just 2 agents, and now we are serving 20,000 plus agents across 40 states, and we are still growing. So today we have an opportunity to learn about Humana's DSNP product for South Carolina. Now, Humana has been growing in the Medicare Advantage space for over 30 years now. In 2019, Humana had more than 8.4 million current and newly enrolled plan members using their services. And their continued growth is not necessarily just due to savvy marketing, but it's also great customer service. In 2019, Newsweek ranked Humana #1 in member satisfaction among health insurers. So today, we're lucky to have Robert Galunas and Anna Hendrickson. And now, Robert, he's an external distribution manager with Humana. And in addition to sharing product knowledge, he and Anna are also going to share some workable strategies to better position ourselves for success when we're introducing our clients to the advantages of Humana. So before we get started, a few housekeeping rules. We're going to hold all questions until the end of the presentation. If you do have questions, just type in the box on the right-hand side of your screen, and we'll get to as many as we can at the conclusion of the presentation. So now, without any further delay, Robert Galunas and Anna Hendrickson.
Brian, thank you very much. Good morning, everyone. Thank you for taking the time to join us. Yeah, so up on the screen you see the title of the presentation that we've been doing here is DSNP Bootcamp. Typically around this time of year, we're out in the market. We're out in front of agents. But obviously the circumstances, call for us to kind of change our approach a little bit. So we're doing a virtual DSNP Bootcamp. And as Brian said, we have a very, we've had significant DSNP growth in South Carolina. In 2019, South Carolina was the #4 market for overall DSNP growth. So far in 2020, we're the #6 market overall for DSNP growth. So it's a tremendous opportunity for agents. Last thing I want to mention is just again, thank you to Brian and Messer Financial. We've been fortunate enough to be partners with Messer since the very early days, and I've worked with this team for over 14 years. So great partners, a great group to work with, and certainly a great opportunity for agents to work with as well. So I'm going to jump right into the presentation. The agenda, a lot of this we're going to move through quickly so we can really focus on the most important aspects of this, but I do want to do kind of a virtual introduction to a new team member that we have for the South Carolina market. It's going to be integral to our DSNP efforts. We'll talk a little bit about low-income customer insights. We'll talk about the fundamentals of LAS and DSNP. We'll spend more time talking about the local plan details. Why the South Carolina DSNP plan is such a great product for your clients. We're going to go talk about eligibility enrollments. Okay, that's connecting the dots there to understanding the plans to get your folks moving. And then we want to share our thoughts and ideas around grassroots marketing and agent resources. So very quickly, just wanted to introduce ourselves. As Brian said, my name is Robert Galunas. I'm the boots on the ground, and my partner here on the webinar this morning is Anna Hendrickson. She's the broker relationship executive for South Carolina. We're going to both work together on the presentation. The names should look very familiar. I'm sure you have either attended meetings with us, been on calls with us, heard from us through emails. We work very hard to stay in touch with all of our agents. And again, Messer is a great partner of ours, so we know a lot of the agents and work very closely with you as well. On this screen, on this slide right here, it's just our market contacts for South Carolina, the South Carolina market specifically. You can see on the right-hand side how the market is kind of split up here in terms of geography. We do have market managers across the state, kind of the local market managers, where we handle all of the external distribution statewide. And there are some contacts for our market offices as well, and we'll kind of get more into the importance of those market office numbers later. So the new team member that we have in South Carolina, we have brought on a DSNP community outreach manager, and her name is Mona Nikravesh. And the goal is to, as soon as possible, get her out in front of our agents so you can meet her and understand the importance of what she brings to this team. So, I had her send me a little snippet of how she's going to fit into this organization. I'm just going to read it. So, main responsibility, we've got to help grow our DSNP sales opportunity around the state by building connections with agencies, organizations, churches, and other groups who work with and serve the low-income Medicare population of our state. She will also work very closely with sales agents around the state and help support them to identify opportunities to serve more members and help connect them to the wonderful life-changing benefits built into the DSNP plan. So Mona is really going to be the conduit between agents who want to get engaged and involved with the DSNP communities and finding those opportunities. All right, so she's going to be working behind the scenes. Her previous role was in community, basically community outreach before she came to Humana. So she has a lot of connections. She's going to help agents who are interested in serving these communities and working in these communities, identifying opportunities, getting started, and moving forward with it. So she's going through her life and health licensing right now. This is obviously going to provide her some great time to get that finished. But as soon as we kind of start coming out of this current situation, you're all going to meet Mona, and we're going to have her out, and she's going to be helping agents tremendously. All right, so very quickly want to go through the first couple sections there is understanding low-income consumers and what that market looks like. So when you think about DSNP, and I know you've probably had a lot of webinars lately and a lot of DSNP, so some of this is a little repetitive, but hypothetically, you wake up in the morning, you've had your breakfast, you're at your kitchen table, and you're thinking about what you have to do today. And on that list, you need to go grocery shopping, and you also have a bill from your doctors. You need to pay a copay or a doctor bill. The problem is that money is so tight, you can't afford to do both. You have to do one or the other. So millions of Americans are faced with these challenges every day. All right, and maybe it's not that situation. Maybe it's, do I go get my prescription filled, or do I, pay the mortgage? Do I pay my bills? Do I pay utilities? It's a struggle every day for millions of people. And you can only imagine with the current pandemic right now, this is being exacerbated. Many, many more people are having to make these decisions. So the good news is DSNP plans help remove that choice, remove those barriers, to where you don't have to worry about copays. You get over-the-counter benefit that helps you with some of the common, over-the-counter medicines and items that you need. And you have a transportation benefit that can get you to the doctor, to the pharmacy, to the gym. You can also do this. This is also a way for you to grow your business while doing good. And that's really where we go. The first thing we think about when you think about DSNP is this is something that you lead with your heart. Your intentions have to be to help people first. And when you do that, you can be very successful. And the DSNP population is growing every year. And again, as I said, this is only going to magnify it, but it's also an opportunity for agents to sell these plans. That opportunity is growing tremendously. And we're here for you. We have a lot of selling strategies. We have a lot of tools. We have a lot of resources to help you be successful and help you reach out to a lot of people that are in need. So first, we want to talk quickly about LIS, because it can get confusing when the terms LIS, Medicaid, DSNP come up, and understanding what each piece means and how that impacts your clients. So LIS is not DSNP, and LIS is not Medicaid. LIS, Low Income Subsidy, is a federal subsidy program which impacts prescription drugs. All right, it's not the Medicare Advantage, it's not the medical side, it's the prescription drug side. All right, and that can help clients with premiums, deductibles, and copays. And LIS, Low Income Subsidies, apply to most of the Medicare Advantage and PDP plans that are available through Humana. Qualification for LIS is based on income and assets. All right, so most of you probably have this information. There's in order to qualify for LIS, Annual income less than 17,226 as an individual, 23,274 as a married couple. And then your assets and resources below the level shown. All right, so you're meeting with clients. Typically, they're going to know their income, all right, or they can share a pay stub or information that helps you best understand what their income might be. The assets and resources, that's probably trickier to figure out. So the best tip I can give you when it comes to LIS enrollment and you're meeting with clients is, first, try to understand what their income and assets look like. If you don't know, if they don't know, they've never applied, help them apply. So step number 2 is help your clients apply through one of the available ways of doing this. All right, if you know someone has limited resources, and from what you've seen, what they've showed you, they may qualify. Help them apply. Don't take a guess and say, well, I don't think you do. Help them apply, because the worst thing that can happen is, they don't get any help. But if they apply and qualify, they get that help right away. So they can go to socialsecurity.gov online through extra help section. And I strongly encourage you to take them there and walk them through. It's less than 10 minutes to complete the application and can obviously, change their lives by giving them help with that. You can also call Social Security, or, probably not the best option right now, but you can go to the local Social Security office and fill out an application in person. So once you complete that application, Social Security will review it and send the client a letter letting them know if they qualified, and if they qualified for what level. As I said earlier, the good thing is once they complete the application and submit it, if in fact they qualify for LIS, it goes into effect almost immediately once that's put in place. It's very important. Follow up with your clients to make sure that they've heard back from Social Security. Make sure they have their paperwork. Make sure that they know what's going on. All right. In general, and I don't want to generalize too much, but you need to stay on top of these folks to make sure they understand the process and work through the process to get what they need. And finally, we have our enrollment tools. You can log into one of the enrollment tools and view the plans in the area to see the LIS premium. Click on the LIS premium to see what the impact's going to be. So based upon the assistance that they're getting, you can tell what the impact on their premium is going to be for the plan that they want to enroll in. So step number 5 here, your client may qualify for low-income subsidy special enrollment period. All right, LIS individuals can make one plan change per calendar quarter for the first 9 months. And we'll talk more about that eligibility and the SEPs a little later on in the presentation. All right, but the thing, what's important to understand is someone that qualifies for LIS does have a special enrollment period to go ahead and enroll and make changes. So LIS is one way to help your clients, all right, to help your low-income clients. It's important to understand, however, that qualifying for a DSNP plan is based on Medicare and Medicaid eligibility. So LIS, qualifying for LIS, does not mean they qualify for DSNP. Okay, it's not interchangeable. However, if someone qualifies for a full dual special needs plan, they do qualify for LIS. All right, so that's the kind of the relationships between the two. Okay, qualifying for LIS does not mean you automatically qualify for DSNP. So quickly, talking about DSNP plans. Okay, what are they? So now we understand what LIS is and how that impacts prescription drugs. Dual eligible special needs plans. Okay, these are Medicare beneficiaries who have the required Medicaid eligibility level. All right, and that differs by state. So if you sell in multiple states, you probably know each Medicaid office, each Medicaid program, state-based, works differently. Different payment categories, different qualification levels. It can be confusing, it can be tricky. And that's why a little later on, we're going to talk about making sure you verify eligibility. Because the worst thing you can do is go through the benefits and tell folks about all the benefits they're going to get and then find out that they don't qualify. But these plans are so important is because they help low-income individuals have a better quality of life by combining the benefits of Medicare and Medicaid. Okay, it also gives them additional SEPs throughout the year to, if they qualify and if they have changes in that status. Why are D-SNP plans, why might D-SNP plans be a better fit than your traditional Medicare Advantage plans? All right, why would it make sense for someone, low-income person, to enroll in a D-SNP plan versus a traditional HMO or PPO? Well, I mean, it's pretty simple. D-SNPs may offer more benefits than clients are receiving with those plans. And typically the premium is either going to be very low or in most cases $0, because the plans include the Medicare, Medicare Advantage and the Medicaid combined. All right, so the idea is to remove the barriers for these low-income individuals, remove the out-of-pocket expenses for them. Again, important to remember, dual eligibles can enroll in any plan they choose, so they're not required to enroll in a D-SNP plan. As we talk about the benefits of the plan in South Carolina, I think it's going to be pretty easy to understand why the D-SNP plan is the best fit for them, without a doubt. So, as that last slide said, most of these plans have additional benefits. So, the South Carolina D-SNP plan includes things like dental coverage, vision, fitness programs with silver sneakers and Go 365, a hearing benefit, over-the-counter benefit, and it includes prescription drug coverage. So the plans are very robust. Okay, they're built to take into account the challenges and needs that these individuals face on a daily basis. It is not just about the copays, deductibles, and MOOP. All right, it's about the other things that they have to struggle with and deal with every day. And the goal is to remove as much burden off of them in regards to those other responsibilities. Another significant advantage to D-SNP plans for these members is that they have access to all the plan network providers. Okay, they're not restricted to Medicaid-only certified providers. All right, so they enroll in the South Carolina D-SNP plan. They have access to the entire network across the state. Okay, just like the traditional, HMO Medicare Advantage members would have. So again, it improves and opens accessibility for these members. And for agents, the key thing about this for you, it's a year-round selling opportunity. All right, SEPs for folks that qualify, and then SEP for folks that have a change in status. All right, so it's an ability to write business all year long. And again, once we talk about the numbers, you're going to see it is a huge opportunity to help folks because this population is growing significantly. So we shared this slide with our agents during our first meeting of the year. We did fast start meetings, and that was really talking about all the different SEPs that are available to you. But look at this graph. All right, you have 10.3 million folks that are moving to a new address, making them eligible for a plan change nationally. You have 3.6 million folks that are aging into Medicare, turning 65. Take a look at that slice for D-SNP plans. 22 million people qualify for D-SNP plans. All right, try to absorb just how big a number that is when you look at the rest. When we talk about, typically we talk about the opportunity with 10,000 folks a day aging into Medicare and that new to Medicare opportunity. Well, that opportunity to help folks that are low income and qualify for D-SNP plans is exponentially more. In South Carolina alone, you can see we kind of did a chart here to show you what the opportunity looked like for various counties. So I just ran a list, and kind of tried to give a good cross section of different counties across the state. All right, and you can see total MA eligibles. That's a great opportunity number right there. That second category, LAS eligibles. Again, because they're eligible for LAS doesn't mean they qualify for a D-SNP plan. But from an income perspective, all right, this is probably your best target in terms of folks that are more likely to qualify for D-SNP. All right, so take a look at those numbers. In Greenville County alone, 42,000, over 42,000 people are eligible for LAS. Right, that's tremendous. All right, you look at these numbers across South Carolina as a whole, all counties, not just that are listed, over 500,000 people are eligible for LAS. All right, so that's the opportunity, or those are the folks that are eligible. If you want to see something that's really interesting, is look at the far right column on this slide. Okay, these are the number of beneficiaries actually enrolled in special needs plans from 2006 to 2020. Okay, that far right column for 2020, 3.35 million are enrolled in special needs plans. 86% of that number, that 2.88 million, well, that's dual eligible. All right, so it doesn't take much to do the math that only less than 3 million of the eligible 22 million are enrolled in DSNP plans. That's opportunity. That's a lot of people you can help. So you may be thinking to yourself, well, heck, where's the disconnect? The disconnect is that most of these folks don't know there's help out there. They don't know anything about DSNP plans. They don't know that because they're on Medicaid, they could be getting additional assistance through a dual eligible plan. All right, that's our job as agents, to help them and to make them aware and to let them know that there's a lot of help out there. All right, and we'll talk more about that. Again, that's the grassroots marketing. That's raising your awareness in your markets. So let's talk about the South Carolina plan. We have offered this plan, the 5619-082, the full dual DSNP plan HMO in the state for several years. And over the past 2 years, we've enhanced the benefits tremendously. And in 2019, you can see the green was where was the footprint for the DSNP for 2019. And for 2020, we've added all those counties in pink. So essentially, this is a statewide DSNP plan with the exception of Sumter County. Okay, so poor Sumter County. We're trying to get that all figured out so this map will be completely, it's like we lost a piece to a puzzle when you look at this, when you look at the picture. Okay, so the great thing about Humana, one statewide dual SNP plan. Some of the key selling points, obviously it's zero premium, no referrals. This is an open access HMO for your DSNP clients. Again, expanded 21 county expansion for 2020. Members are cost share protected. What that means, zero out-of-pocket costs, no copays, no deductibles, no MOOP. All right, again, these are full dual eligible, so that's the whole goal, protect them from out-of-pocket costs. Eligibility, we'll talk a little bit more about this, but the qualifying levels, QMB, QMB plus, and full benefit dual eligible are the categories. Right? I know early in 2020 we talked about a partial DSNP plan for SlimB members. We've continued to, I don't want to say fight, but we've continued to have issues with the state to get that eligibility file. For now, focus on the dual SNP plan. Page 8 to determine eligibility, we do have a job aid in our product book that we'll talk about. Now, as I said, there's no out-of-pocket costs for the medical, for the copays, deductibles, coinsurance. And if you opened up our benefit summary and every other carrier's benefit summary to those pages, it would look the same, right? So going by that doesn't really help your client understand which plan is best for them. It's this stuff. It's the supplemental benefits that are really going to make the biggest impact on them and be able to help them determine which plan is best for them. So let's talk about that. So in 2020, supplemental benefits include dental. These members get $3,000 annual max, and they have zero copayment for exams, fillings, cleanings, unlimited extractions, crowns, x-rays, and dentures. All right, so that's on the slide twice. It must be that important. So, you're reading that correctly, $3,000, zero copayment for all of those services, including dentures. And we improved the benefit to unlimited extractions, for the DSNP plan. So the folks that really need those dentures can get those teeth extracted to get the dentures. And that's up from, we've actually increased the maximum from 2019 to 2020. Vision, very similar. Last year, this benefit was $300 annually. 2020, it's $500 annually. Why? Well, we understand that many seniors have more specialized needs when it comes to their glasses, including different types of lenses, progressive, transition, whatever. So, with the vision, it's a $0 copay and $500 annually for eyeglasses and contacts. Right? That gets them some very nice glasses or many pairs. The OTC benefit is one of the true highlights. $300 a quarter. This year, we introduced a full color catalog with pictures of the items that your clients can get through the OTC benefit. $300 per quarter goes a long way. All right. And we'll talk more about tips, to kind of help your clients understand that benefit as well. Our hearing benefit, we partner with True Hearing. This is another highlight here. So with the hearing benefit, it's $0 for the exam, $0 for the fittings, and $0 for the hearing aids through True Hearing. All right. So, these hearing aids, retail $1,400, $1,500. They're at no cost to your members. You get one per ear through True Hearing, along with 48 batteries at no cost. Again, tremendous benefit for folks that are hearing impaired and need hearing aids, because they're not just getting, average hearing aids. They're getting high-level, advanced hearing aids. Transportation benefit includes up to 36 one-way trips to approved locations, meaning doctor's office, pharmacies, and includes fitness centers. All right, so these folks can get to the gym, go to their silver sneakers classes. These are just the highlights. That's kind of the first page of the supplemental benefits. It's important to understand that the benefits get much deeper when you're looking at what they offer. These individuals at no cost get a Philips Lifeline personal emergency response system, have access to smoking cessation program. They get chiropractic services, so no copay for up to 12 visits. They get a expanded well-dine meal program. Okay, that goes by Mom's Meals this year. MD Live, so they have access to the telemedicine benefit, which right now especially is an important thing to have access to. All of our plans include Silver Sneakers, and right now Silver Sneakers is really pushing virtual and online programs available at no cost to all of their members. Go 365. If you're not familiar with Go 365, get familiar. All right, it is a rewards program, Humana's rewards program. Your clients can earn rewards which translate into gift cards by doing healthy activities, including just getting some annual screenings and exams done. And then finally, a $500 maximum benefit per year for wigs when it's related to chemotherapy treatment. This may not get as much publicity as a lot of the other benefits when you think about dental and vision and hearing, but if you're impacted by cancer and you need a wig, this is a pretty significant benefit. All right, this goes a long way. So one of the selling strategy tips we have, I talked about OTC. It's important that with the supplemental benefits, you show the impact on the quality of life. All right, these supplemental benefits are the game changer kind of things. So with the OTC, walk through the OTC allowance: vitamins, supplements, pain relievers, costs, allergy, personal devices, products to manage diabetes. Help them fill out that first order. Show them just how much they can get. Show them how many holes this OT benefit will fill. And I can tell you, when you help them do that and those boxes start showing up on the doorstep, they're going to be thrilled, and they're going to let you know about it. The whole idea, as I said, is these plans are more than potential savings with copays and MOOPs. The small things that make a major impact on the quality of life, for these folks that are low income or living with limited means. So compliance updates, very quickly, just to understand, as we said, there are some changes to the SEPs, changes to the compliance in terms of eligibility and enrollment for these plans. So effective January 1, 2019, CMS changed their guidance for dual eligibles, or LIS. Someone that qualifies for a plan has not had a change in level may enroll, disenroll, or switch to another MA plan once per calendar quarter during the first 9 months. All right, so any changes made during that last quarter are AEP. That's an AEP election. But folks may make a change if they're on a dual eligible plan, they have not had a change in level, they can make a change once per quarter. All right. Also, if they've had a change in status, all right, so they're on a dual eligible plan, but they now have a change in status. Individuals who become eligible for any type of Medicaid or LIS, or lose eligibility for any type, or have a change in level for their Medicaid or LIS, have a special election again that can be made once within 3 months of the qualifying event or notification of the update. So there are two different SEPs. One for folks that are on dual eligibles and want to make a change. One for someone that has a change in status. They become eligible, they lose eligibility, or their eligibility level within Medicaid changes. Also have a different SEP. All right, important to understand. What does this mean to agents? It means during the fourth quarter, October to December, basically AEP, LIS dual eligibles who have not had a change in their level and wish to make a plan change, want to make their quarterly change, must use the AEP to make that election. All right, so that MDE election code may not be used during the fourth quarter. All right, so, really think about it. Is your folks LIS eligible or have a change? Their changes are during the first 3 quarters. All right, so at this point, I'm going to transition the presentation over to my partner, Anna Hendrickson, and she's going to take you through the next sections.
Thank you, Bob. Are you able to see my screen and hear me?
We can see and hear. You're good.
Excellent. Thanks so much. Good morning, everyone. Thanks for having us. I'm jumping in here at the eligibility and enrollment tools section. And Bob mentioned this earlier, but we want to make sure that we always verify a member's level of eligibility. So when we call in to verify, we're going to have either the Medicaid number or the member's Social Security number to do that. And there's a couple of different ways that you can verify. You can call one of our local market offices in either Greenville or Columbia if it's Monday through Friday between 8 a.m. and 5 p.m. Or if it's outside of those hours or for some reason you're not able to get through, you would be able to call our agent support unit. And I would write this number down. It's obviously in all of our product booklets, but it's very helpful, 1-800-309-3163, and then follow these prompts. It's option 1, option 3, option 2, option 2, and if you do that, I'll say it again, option 1, option 3, option 2, option 2. If you follow those prompts, you will have no wait time and you will be able to get right into someone to help verify that the member has either QMB, QMB Plus, or certain levels of FBDE in order to get into this 082 DSNP plan. Also, we just want to remind you that in order to verify the level of Medicaid, we don't recommend calling the state South Carolina Healthy Connections Medicaid office. The reasons that we would call there would be like every once in a while, maybe somebody has 2 Medicaid numbers and you're trying to help get it straightened out, or other kind of one-off situations. Those would be reasons to call South Carolina Healthy Connections. But if you do need to verify someone's level of eligibility to get into a Humana plan, we really recommend calling either the market office or agent support. And again, you're going over these wonderful plan benefits. You're telling them everything that they're going to get. And then let's say like afterwards, they end up not having the correct level, then you've, promised them all these wonderful things that they can get, and they're going to have a broken heart. So try to prevent that by, right away when you find out someone has Medicaid, verify what level they have. Super important section here, as I mentioned earlier, the FBDE category of Medicaid. There are 5 PCAT codes that are not accepted for enrollment or eligibility into this plan, and that's PCAT code 40, 48, 50, 52, and 55. So just keep in mind that even though they will show up as FBDE with these PCAT codes, these 5 are not accepted for enrollment into this plan. And also, we're not able to process future effective dates of Medicaid. So if somebody has, a May 1st or a June 1st effective date of Medicaid coming up, we're not able to process that in advance. So if you submitted that application today, it would get denied. We're not able to process the future eligibility at this time. And we hinted at this before as well. This is the job aid, which is available in our 2020 South Carolina product book, also known as the Brent book, and it's on page 8. So this is going to have all that great information that we just went over with the Medicaid levels and also the market office phone numbers and agent support. So just keep in mind the Brent book, the 2020 product book, page 8 has all of this in it for you. If you do need one of those product books, we can definitely get those to you. We have a PDF we can email to you right away. And also, the next step would be step 2, to confirm that your member is ready to enroll. So after you have presented all the plan benefits and you are going to determine how you're going to send the materials, you're going to make sure that you have the Medicaid identification number, and then you can choose either Enrollment Hub, MAPA, FastApp, or paper. Those are the Humana options. I think that Messer, you guys have another option as well, and I think you guys do a pretty great job of covering that. But today we're just going to focus on Humana options. So we do have this flow chart. If your member has an email, the best option is going to be to use Enrollment Hub, and also referred to as eHub, with electronic signature. Typically, another great option is to use our digital marketing materials or the agent online application link. But unfortunately, at this time, our DSNP plans are not available through those portals. So for the sake of the DSNP plan, we're going to have to stick to the Enrollment Hub or FastApp. FastApp, you are also able to do an electronic signature. And another feature about FastApp is if your member does not have an email address, you are able to do a telephonic signature. It's an IVR line, and you can help your member enroll that way as well. Or option 3 would be to do a paper exchange. I know there are some agents that are still, using a bunch of hand sanitizer, standing 6 feet apart, and maybe standing, outside of the client's door doing meetings that way. That would be an option as well. We also want to make sure that we're staying compliant. So if you are going to do a telephonic sale, you want to make sure that you have permission to contact the person if they're not in your book of business, if they're not currently a member. And you can either use one of our contact forms, or an email would suffice, requesting contact from the member. And then also you want to make sure that you're going to secure a scope of appointment. We do have a telephonic scope of appointment line, which is 866-945-4471. If your member obviously does not have an email and you are able to do a 3-way call into the system, you are going to be the captain of the ship. You will drive this call, and you're going to provide your writing number, also referred to as your SAN number, and the client's information. And once you go through, you're going to capture the scope of appointment verification number. You're going to write it down and keep that for your records. Also, we understand that compliance has changed. However, the system has not been updated. So if it is a same-day request, just state that the client requested for the same-day appointment, and you can move forward. And then also, we did update our systems, but if for some reason your system did not update, it was throwing an error message if you just used the 8-digit scope of appointment number. So you can add a 0 to the beginning if for some reason you're getting an error if you're trying to enter the scope of appointment number, and that should help fix that situation. If you're doing a telephonic sales presentation, just keep in mind that the following materials still must be provided to all potential enrollees who have agreed to participate. And that is obviously the sales kit, the Humana all-in-one book, which includes the summary of benefits, the non-discrimination notice and multi-language insert, the star rating sheet, and the prescription drug guide, if applicable, which it is in this case because our DSNP includes prescription drugs. Also, methods for sending clients the materials. You could advise them to log on to humana.com. You could download the documents, our entire enrollment book, from the Medicare document library and email it to them. You could mail them the sales kit, the Humana enrollment book, or you could do a drop-off in person. And again, the telephonic sales presentation, we want to make sure that we're completing a compliant sales presentation. So you're going over the sales presentation video as well. There's a couple of options for you to send that to them. You can send them the link. You could mail them a copy, or you could send them an emailed PDF copy of the sales presentation. And if for some reason members do not wish to receive those materials electronically, you are able to go through them verbally, through all the talking points of that sales presentation to make sure that the beneficiary has been advised about all of the important topics addressed. And again, just wanted to quickly go over that typically these down below here, all 5 options are great options to use for enrollment. However, for DSNP, digital marketing materials and agent online application are not options. So best option is if your client does not have an email, use FastApp, and you're able to do that. A 3-way call for the telephonic scope of appointment. You can go through the entire application through FastApp and then do a telephonic IVR signature. If your client does have an email, you are still able to use FastApp or Enrollment Hub. And then Enrollment Hub is nice because it does give you a yellow circle or a gray circle if the information is not completed, and it's pretty helpful to guide you through that. We are also moving our enrollment platform. Most everything should be moving over there. We're hoping by the end of the summer. And Enrollment Hub is a pretty user-friendly tool. However, if your member still, you or your member still need to do a paper application, just keep in mind we're not able to accept any applications through the mail at this time. Our processing center is not able to do that due to the COVID-19 virus. So just keep in mind that if you are going to do a paper application, you would have 3 ways to submit it. You could submit it through the Vantage upload in your Humana Vantage portal. You could use the electronic document transmitter app and submit the paper application that allows you to take pictures and upload it, or you are able to use the fax line as well. If for some reason your member is going to be disenrolled from a DSNP plan, eligibility is verified monthly, and that happens if a member's income rises above the eligibility threshold for any reason. They might be disenrolled from the plan. Members are given a 6-month grace period to regain the eligibility, and if at the end of the period they're unable to regain the eligibility, Humana will notify the member by letter of their upcoming disenrollment. And that is also referred to as a deeming period. Encourage your clients to contact you so that you can help them navigate the next steps, and that they reach out to you. And that way you can help them through this process. A lot of times members are able to regain eligibility. And of course, you want them to reach out to you so that you can maintain them as your clients and keep them in your book of business. The next section here we're going to talk about is grassroots marketing and ways to grow your business. So this is typically a see and be seen in your community approach. We understand that recently things have happened to make us stay in our homes and not necessarily be out and about in the community. So there are other ways that you're able to reach out to your members at this time and ask for referrals. But again, in the hopes that this is soon going to clear up and we are going to have the opportunity to get back out in our community again, we do want to talk about ways that you're able to be noticed and increase your business. So grassroots marketing includes strategic targeted community relations activities designed to increase business development opportunities. That's the nice fancy term for that. So grassroots marketing, it's not a standalone experience. It's not a one and done. It's not I did my one event for the year and it's over. So this is an approach, a marketing plan for the entire year. And if it's correctly done, it's a combination of metric-driven marketing activities such as direct mail, media, digital advertising, and also activities within your community. Check out the Marketing Resource Center, also known as the MRC, which is in the Humana Vantage portal on the left-hand side. It has marketing resources to help you with your grassroots strategy. Also, just as a note, Agents may only target marketing efforts exclusively to dual eligible individuals if they're certified to sell DSNP in that individual's area, since CMS prohibits targeting non-DSNP plan marketing efforts exclusively to dual eligible individuals. So what does grassroots strategy mean? It's from first meeting to membership. So making a sale, having a smile on your face, a friendly hello, and eventually, when we can get back to it, a handshake. You know, obviously right now we want to try to maintain social distancing and as much as we can, and being as compliant as possible. Also, we do have a 5-step guide to building business in your community all year long. So we want to make sure that you understand that things and places where you are able to go. You could volunteer where prospects might be, like churches, food banks, and soup kitchens. You can attend events that draw a crowd, such as health fairs and expos, cultural festivals, or farmers markets or flea markets. And it's also helpful to reach out to where events are going to happen, so check your community calendars. Places like the Chamber of Commerce, local television or radio stations, and senior centers. Also, you can network and partner with business owners. So you're able to post flyers on public bulletin boards. You can set up tables in stores to meet prospects, and you can also ask for introductions to other leaders. Marketing in a healthcare setting cans and can'ts, do's and don'ts. You can conduct marketing activities as long as they are only in common areas of healthcare settings. So in other words, entryways and waiting rooms are fine, exam rooms and pharmacy counters are not. You want to make sure that you have your healthcare providers present at events as long as they discuss only educational topics and don't promote their practice or a specific plan. Things that you cannot do would be reach out to beneficiaries living in long-term care facilities and request to have a meeting for one to take place. And you cannot allow healthcare providers to offer a scope of appointment forms or enrollment applications at their facility. Step 2 would be to nurture your leads. So the Marketing Resource Center materials allows you to have CMS approved materials. So these are things that are they've already gone through compliance, they're ready to go and approved. You just have to upload your information. A lot of them are customizable, and you can pick your format if you want to have your picture on the flyer. If you just want to have your, agent information and phone number, that's allowed as well. It's up to you. It's your choice and your convenience. You can ship materials to you or directly to your prospects. So we have plenty of options for you, and we'd be happy to walk you through that option as well. And you want to, step 3, make your meetings count. So do everything that you can to be relatable and approachable. And most times you can skip a suit and tie. In your sales presentations, make sure that you lay out plan details in layman's terms. This business is full of acronyms, and this entire presentation we've been talking about DSNPs, and we're just assuming that you know that it stands for Dual Eligible Special Needs Plans. But again, anytime you're in the presence of a member, you're going to want to try to stay away from acronyms. We still want you to dress professionally and or, for the crowd that you're going to be around. So just keep that in mind. And then also let prospects know that you lead with your heart, and helping people is the best part of your job. Have an elevator pitch, a 60-second speech on why you do what you do and why you care about seniors and the DSNP community. Educational events. So educational events are designed to inform beneficiaries about Medicare Advantage, prescription drug, or other Medicare programs. Things that you can do: you can display a banner, give away promotional items under the nominal value threshold. You can set up future marketing appointments and distribute business cards, contact information for beneficiaries to initiate contact with you. And this includes completing and collecting a scope of appointment form. Must be advertised as educational with correct disclaimers. So you're not You do not have to report these to CMS. However, we do work with a wonderful marketing administrator, Kim Patterson, out of our Columbia office, and she does like to know about these. It does help us, kind of know what's going on and how we can help you with what you're doing. So feel free to let us know or let Kim know so that we can do as much as we can to help support you. One nice thing about educational events is that a full meal can be served. So as long as the event meets the strict definition of an educational event, you can serve a meal. You must report the event to the local sales office. We do really encourage you to do that. Again, like I had already mentioned, and then also just because it says Medicare 101 doesn't necessarily make it an educational event, so be sure that you're following the guidelines of the educational event. Things that you may not do: you may not include any sales or marketing activities or distribute marketing materials or enrollment forms at the educational event. You may not distribute or make any marketing materials that include specific plan information, premiums, co-payments, or contact information. Or you may not discuss plan-specific premiums and benefits. Now, this is another form of marketing, and it is actually called sales and marketing events. And what you can do is it includes sales activities or presentations where a Humana sales agent promotes specific Humana benefits and services. It's going to talk about specific plan details. You can accept and perform enrollments at these events, sales and marketing events. And where the Humana plan is being presented, it must be reported to the sales and marketing support executive so that it can be reported to CMS. Sign-in sheets must clearly be labeled as optional, and health screenings or other activities that would be perceived or used as cherry picking are not permitted at sales and marketing events. And again, agents may not require attendees to provide contact information as a prerequisite for attending an event, and you may not provide or subsidize any meals at a sales or marketing event. We do have the ability for you, if you are really interested in doing a sales and marketing event, we do have a sales seminar certification, which is available in the MarketPoint University. Once you complete that, then we would have you complete a face-to-face training with one of our market managers, and then we would want to know about your event probably about 2 to 3 weeks in advance, if not more than that. So just keep in mind that's kind of the timeline for a sales and marketing event. If you are going to do an informal event, also referred to as lead generation activities, these are typically conducted in a less formal environment. They allow a beneficiary to just walk up to an agent, learn more about product offerings with less structured presentation, and these events sometimes use a table, kiosk, or recreational vehicle that's manned by an agent who can discuss the merits of Humana's products. Another really helpful tool that we have available for you in the Marketing Resource Center is Programs in a Box. And Programs in a Box is an initiative to help you with combining educational seminars and materials to large amounts of groups of people. So we do have a library which features over 35 classes, and it's designed to present easy to follow health and wellness presentations in an environment that's comfortable and informative. Our educational classes range from 30 to 60 minutes and cover a variety of well-being topics. And so you're going to see here on the screen some of the marketing materials that are used to promote the Programs in a Box. These are meant for you to reach out to the senior or low-income population to talk about things like health and lifestyle, nutrition, behavioral health, caregiving, chronic conditions, technology, and these have been designed so that you can connect with this population, and it's not just you walking in as a sales agent expecting a sale immediately. This is what you're doing to build rapport. You're growing your business, boots on the ground, grassroots style, and we have these available for you. So keep in mind that basically any of these on the list here that have an asterisk by it do require a physician or a clinician to be with you. I know one of the most popular Programs in a Box courses right now is the Tech 101, protecting yourself against scams, and the using technology to stay connected, since we've all been so isolated. So those are super popular right now. Just keep that in mind. But these are really great programs. They're already designed. They're all ready for you. Just go into the Marketing Resource Center, and you can go ahead and let us know that you're doing them as well, so we can help you with any resources you might need. And again, this is just showing you an example of what the programs in a box materials and presentations look like. So step 4 of grassroots marketing, you're going to keep the enrollment process simple and straightforward. If you think that your prospect is possibly low-income subsidy eligible, show them how to apply on the Social Security website. Have them call, or you go ahead and call the agent support unit to confirm their level and help them enroll. And then step 5 is following up. So this is super important. You always want to make sure that you're following up with your members. We do have the 3, 30, 60, 90-day conversation guide. It's an excellent tool for you, available through the Marketing Resource Center as well. You want to call your client and explain what they can expect. You want to ensure that they've received their member ID card and their other plan information in the mail. You can answer any questions that they have and help engage them with their added benefits. And then also, we want to make sure that you are keeping your clients in your book of business. So always make sure that they are calling you and referring back to you with any questions that they might have. Also, it's a great way to ask them if there's any referrals or any other individuals that might benefit from the robust plan benefits. Again, here, it's just a couple of ideas on day 3. You're going to call to thank them for enrolling and tell them what they can expect. Day 30, other ideas here as well of, make sure they're signed up for Go 365. Typically, every member that has a Medicare Advantage plan is going to be signed up for Go 365, but we do have a lot of ways that they can earn rewards right away. And so we want to make sure that they understand how to do that. We want to make sure they're happy with their primary care physician. You can also go in and request to change their primary care physician for them through the service inquiries tool in your Vantage portal. Day 60, you can call them and let them know about things like their Logisticare, if they need rides, their at-home benefits, over-the-counter allowance, Jenny Craig and Silver sneakers. And day 90, if they have any if they've gone to any preventive screenings, like their annual wellness visit, if they've gotten their mammogram or a flu shot, or help them find a dental provider, see if they've gone and gotten their dental exam. Helpful marketing outreach tips. So we want to make sure you're visible in your community, that you increase awareness of things that you're able to help members with, that you learn your community needs. You're going to look at the data in your community, in your county, and see possible hotspots for dual eligible opportunities. And you want to find the right person to bring to the table. You want to ensure that you have the right material with you for the audience you're speaking to, address the needs of how we can help, research and find community events to possibly be a vendor and share info, practice the 2-part approach, which can help open the door to having dialogue. And earlier in other presentations, we had Mona come on and kind of talk about this one here, number 10. We want to practice the art of connecting and not projecting. So we want to make sure we're really listening to our clients. That's very important in regards to sales. So you don't want to be known as the person who's just going to come in and sell someone something and then disappear. This is actually, a really important job to take care of members in your community. And it's important to listen to the member and make sure that it's not just to place the member into any plan that you think that's best for them. You really want to listen and make sure that you're going through what they need. It's important to hear them when they come in with education to ensure the member makes the best decision for their healthcare needs, and also create a safe space for the member to feel comfortable talking to you. And you are the boots on the ground at all times and everywhere that you go and everywhere that you meet people. again, I had mentioned earlier about an elevator speech. It should be genuine. It should be something that is, really something that you can talk about and feel comfortable talking about, and have a benefit statement in there of how you can actually help your community and your members. So what are some ways that we can keep members engaged during this time right now that we're going through? So due to social distancing, agents can also interact with your members in the following ways. You can pick up that phone, call, do wellness checks, remind them to place their over-the-counter allowance orders, see if they need any help with food, see if there's, food insecurity in that area. Also inform members of what we're doing as a company, and agents can use this time to reach out to providers in real time to get COVID-19 updates. Of course, we don't want, too many people reaching out to the providers because obviously they're very busy, treating COVID-19 patients. But if you do know of a facility that has some downtime, it wouldn't be a bad idea to reach out. Direct mail marketing pieces, follow your book of business, and disseminating information to partners, virtual education opportunities. So if there is an opportunity to get together a Zoom meeting or a WebEx or engage with, a local business where you can do some education, feel free to reach out. Use your network. Use your opportunities to build your marketing plan right now when you have some downtime. Couple more agent resources. We want you to know that the Humana Market Point University is more than where you just go to do your recertifications every year. We do have plenty of options, different topics for you to do training on. So you're going to log into your Humana Vantage portal and click on the Humana Market Point University. You can click Browse Topics and then select Medicare to access the multiple courses. Enroll in and launch courses about DSNP plans, and then also Market Point University. There's a job aid for fundamentals of dual eligible overview, and that can be really helpful as well. And again, the 2020 South Carolina product book, this is extremely helpful and a great tool for you. So feel free to reach out and request one of these if you need it. It's also known as the Brent book. It's going to have basically everything that you need in one place, and it's an extremely helpful tool. Agent support unit again, 1-800-309-3163, or you can always email agentsupport@humana.com. It does typically take sometimes 48 to 72 hours to get an email back, so just keep that in mind. And then hours of operation right now, 8 to 8 Eastern time, Monday through Friday. If you do have any tech issues, they are open 8 a.m. to 7 p.m. Eastern time. We do have a DSNP playbook. Typically, we also have a boot camp toolkit. Unfortunately, we weren't able to do these in public, so we're not able to get them out to you quite yet, but we are going to arrange a way to get these in your hands. It does have some pretty cool stuff in it. It's got the Medicare and Medicaid Ask Me About dual plans, buttons, a little chip clip, and highlighters, some other things in there. So we'll get these to you as soon as we're able to. I think Bob is going to help arrange those. So what are the next steps? You can brush up on your local plan details, get into that marketing resource center in the Humana Vantage portal, plan your grassroots marketing strategies, and contact either Bob or myself with any questions. And we want to thank you for your attention and for being on today. We hope that you stay healthy and safe. And if you do have any questions, please don't hesitate to reach out. We are happy to connect with you and do whatever we can to try to help you grow your business and increase your marketing, and basically anything we can do to help you stay safe and healthy during this time. Don't hesitate to reach out.
Thank you so much, Anna. I appreciate you and Robert going through that information. Just a lot of really great information for our agents to be able to move forward as far as this market is concerned. We do have just a few questions, and then we can definitely wrap this up. The first question is, can you explain the well-dined meal program?
Yeah, so typically well-dined meals are going to be meals following an inpatient hospital stay. And it's typically, I think, for 5 days following an inpatient hospital stay. But even during this time right now, I know members are able to reach out and request meals. So we can definitely get you the information on how to do that.
Okay, great. And then also, the next question says, how do clients get the Go 365 benefit?
So they're actually automatically
Yeah.
enrolled, but they are able to call into customer service, or they can log on to Go 365 and create their account. Basically, it's a rewards program, and they're already automatically enrolled, but things that they do are going to be added into their Go 365 points, and then they can redeem those points for gift cards. So if you are going to be requesting a kit through the customer service line, which is, again, that's just the customer service phone number on the back of the member's card, they're going to get a kit mailed to them. And then once they get that kit, there are papers in there where they can fill out their activities. We try to ask that those get submitted about like October 1st so that they can get processed. And those points need to be used by December 31st. They do not carry over. So if you want to, redeem for $25 gift cards, there are 5 places: Walmart, Kohl's, I think Target, TJ Maxx, are some of the options as well.
Awesome. Excellent. And the next question, where can I find the local market office information?
So it's available in the Brent book, the 2020 product book. And it's also available online. And we, if you have any specific questions, we can reach out to you as well.
Excellent.
And we can make that product book, a PDF version of that right now, available to you for your agents that need to know where those market offices are. And
that'd be
include
great.
that contact information.
Thank you. And then can we get the telephonic enrollment flow chart? So that's the next request.
Yes, absolutely. Yeah. We can get you all of that information. We can send it over.
Okay. And will the AOR be notified of a disenrollment?
Bob, that's a good question. I think so. I think you get a secure email that your member is being.
Yeah, and one of the things, I think we cover this, but your members, your DSNP clients, they have a 6-month kind of waiver period. If they lose eligibility for DSNP, they have 6 months to regain that eligibility before we actually remove them from the plan. So there's a lot of time, because there is an ebb and flow with DSNP and Medicaid eligibility. They have a lot of time to regain that eligibility or complete the paperwork that's necessary. At the end of that period, we do notify them, and the agent does get an email notifying them that their member is going to be disenrolled, so you can in turn help them with their next move.
And I think the secure email, it comes in one of 2 ways. If you have a secure agent email set up in the Humana Vantage portal, it's up on the top right, you'll see secure email. If you have it set up, it'll go there. If you don't have that set up, it comes to you in a visitor account. So just keep in mind that, I know agents get a lot of emails every day, but if you do get something from Humana asking you to log into a visitor account, it's probably a secure email from our agent communications team trying to let you know something.
Okay. And last question here, can you share the 5-step guide and the 3, 30, 60, 90 strategy?
Yeah, absolutely.
Actually, the grassroots, that 5-step is part of our DSNP playbook. And that's something we can make available to agents. We have it in a digital format, a PDF version. It's also something that agents who are going to be attending these meetings in person would have gotten it in a DSNP event kit, which we will also make available to your agents that attended. So that we can certainly provide. And the conversation guide, again, we can provide that conversation guide, 30, 60, 90-day conversation guide in a PDF version as well.
Yeah, and when we're done here, you can definitely, if you want to forward that information to me, I'll make sure it gets sent out to any agents that attended today. That way
Sure.
they can have it in their hands by the end of the day.
Yep,
Robert,
we will send you along a toolkit of all those things requested.
Terrific. Now, Robert and Anna, before we wrap up, is there anything that you want to say in closing?
First, thank you all for joining us. We know right now it's very unusual. The circumstances are very unusual. We are committed to helping our agents kind of navigate through this situation to make sure you have the tools and resources that will allow you to keep selling, allow you to keep doing business, allow you to keep helping people. So, the more that we can do or the more that we can help you, please let us know. We appreciate you giving us this time today, and I'll let Anna wrap up for us.
Yeah, thank you for the opportunity. Also, just want to make sure that everyone is taking some time for yourself. Obviously, this is a very unique time, but just really appreciate every agent out there that promotes Humana and takes care of our members, and we appreciate everything that you do year round. But if there's anything that you need, please let us know. I'd be happy to help.
And once again, Anna and Robert, thank both of you so much for walking us through these processes. I do want to let everyone that has attended, this webinar is recorded. It will be posted on messerfinancial.com in our learning center. Normally between 24 and 48 hours, you'll have access to it, so you can go ahead and listen to it again. Once again, we want to thank everyone for taking time out of your day today. Hopefully you did learn something new that's going to help you increase your business. If you're not currently contracted with Humana, go to SureLC. You go to your SureLC profile and request the appointment. If you're not contracted with Messer and have questions about partnering with Messer Financial, feel free to contact our marketing department at 866-568-9649, extension 7819, or email them at mfgmarketing@messerfinancial.com. They'll be happy to go over all the different advantages that come along with partnering with Messer. Also take a moment to check out our events calendar at messerfinancial.com. We'll be having webinar workshops scheduled throughout the year with valuable information, just like we got from Robert and Anna. Once again, I want to thank everyone for taking the time to join us, and each one of you take care of yourselves and everyone around you. Have a great day.